My name is Dr. Ibupan Oluwabidoye. I'm a senior consultant radiologist here at Evercare Hospital, Lekki. I'm the head of the department of radiology department. Basically, we're here to celebrate World International Day of Radiology, and what we want to do is to celebrate our radiographer and radiologists in caring for the patient. Basically, what we do in radiology is to image our patients with sophisticated equipment, and what we do is to generate images of the body parts, and we interpret the image and give the result of the image to the referring physician for them to adequately and promptly treat their patient.
My name is Moduola Tulokwadesola. I'm a radiographer at Evercare Hospital. Talking about the ionizing radiation, we'll be talking about the X-rays, the CT, and the mammogram, so mammography for the breast as we know it. And the amount of radiation we use when using those are clinically proven to be safe because they are very low, and also because of the state-of-the-art equipment we use here at Evercare and in the world now, the radiation we use are relatively low, and every investigation done are optimized and justified to make sure that we do not give more than needed, so they are safe.
My name is Odewande Oluwanifemi. I'm a radiographer at Evercare Hospital, Lekki. What happens during a radiology exam? So basically, we start from preparation of the patients, where either we sign consents or make sure that the patient changes into an hospital gown, dependent on the radiology exam being done and dependent on the clothing that the patient might be wearing. And then we move to the point where we position the patients, like a CT machine here, X-rays, MRIs. They have different positioning dependent on what radiology exam we are doing and what procedure we're undergoing. And then we move to monitoring of the patients, where we make sure that, after properly explaining the procedure, during the preparation phase, we make sure that, they are properly monitored, where they follow the instructions they might have been given. It could be breathing instructions, it could be making sure that there is no movements, so there are no movement blurs, so that the images we're getting are clear and sharp for the radiologist to properly report. And then we also move to where the images are reviewed by the radiologists and reported after we're done with the procedure. After the images must have been sent to the radiologist. And after that, the radiologist makes a diagnosis as after viewing these images. So that is basically like a summary of what happens or what to expect during the radiology exam. Once we're done monitoring the patients and once images have been taken, we come back into the room to make sure that the patient is properly taken off the couch and changed into the clothing they must have come in with. And we properly explain what to expect after the procedure, when the results will be gotten, and what to basically expect after the whole procedure. In summary, radiology exams are used for the diagnosis and monitoring of different health conditions.
When coming for radiology investigations, usually advised to come in at least 4 to 6 hours fasting, which would help with the bowel movements and also make sure that you do not react to contrast in instances where contrast might be given. Also would advise you to come in wearing loose fitted clothing, which would help in case you need to change to the hospital gown, and also would advise you to come with minimal jewelry because there's some investigation where would also be needed to take off your jewelry. So you come as simple, as plain as possible. For investigations like mammography, would advise you do not use any roll-on or antiperspirant, anything, even cream or powder in the breast and armpit area.
Here in Evercare Hospital, we have different machines. We have CTs, we have MRI, we have ultrasound, we have X-ray machine, and good enough we have a SPECT machine, which is one of it in country. What SPECT does is that it helps us in nuclear medicine to not just image the body, but even give a functional details about the body. All these are available here at Evercare Hospital, Lekki. In commemoration of International Radiology Day, I want to thank all the radiographers, all the radiologists, and all the medical physicists out there. Thank you for taking adequate care of our patients and giving your best in the treatment of our patients. Thank you and enjoy the week.